Hello, my name is Dr. Rodrigues. I'm a family practice doctor in Dallas. This is my 35th year on the front lines of patient care. And there's confusion everywhere. There's misunderstanding everywhere. And I never thought I'd wake up 35 years in medicine realizing that every physician trained under the heading of American Medical Association was given orders that's harmful. And you might think, not all doctors, and I'll have to say, if everyone followed these orders, they are harmful. The orders are drugs and surgery, surgery and drugs. And you realize that that's not working. I realized this 30 years ago when I was taking care of then called fibromyalgia patients. Mostly women, complex array of confusing and bewildering signs and symptoms, never the same. And you think, this is a hypochondriac. And doctors call them hypochondriacs. But in family practice, you're bound by, you have to take care of this patient for the rest of their life. So then you listen, you think, these folks are sincere. They're telling you their truth. And once you realize that, then you believe them. So you start trying to find treatments for them. So way back when, patients would bring in articles and I'd say, okay, we can try this, we can try that. So these individuals, fibromyalgia patients, had similar set of 15 or 20 signs and symptoms: sleep-related, mental, emotional, physical, social, psychological, spiritual. Their thinking was corrupted, brain fog, couldn't concentrate, couldn't enjoy themselves, utter misery. So back then, I call it the misery syndrome. There was no place to find in any article. You look through your book of orders and you don't see these individuals in there. So you're dumbfounded. You have no answers. You have no ideas. So you refer them to the rheumatologist, and the rheumatologists do their thing. And the patients come back and say, Dr. Rodrigues, he didn't even look at me. He just wrote me a prescription. I think, that's all they did? They would say, you do more than they did. At least you listen and you have some sincerity. So you send them to the surgeons, and they come back and say, Dr. Rodrigues, all they wanted to do was try to fix me. This surgery, that surgery, this procedure. And I says, so why didn't you try the surgery? Well, they said, well, I tried. I have friends who tried the surgery and it never helped. So, first do no harm is a powerful truth statement about what physicians should 100% do 100% of the time, from beginning to end. No less. More, no less. So if a patient comes in with a problem and they can't work, the physician's mission is to treat the individual with enough therapy so they're work ready, they're battle ready, they're ready to go back to work and enjoy working as best as they can. So first, do no harm. First means always. Do, actions. No, never. Harm is criminal. Anything less than returning the patient back to full duty work and play, so they can pursue happiness is harm. So harm means you have betrayed the individual. Hurt is different. Football hurts. Sunburn hurts. But harm is a unique interpersonal deception. Lying, cheating, stealing, deceiving. Harm. Punching somebody in the nose. Harm. Yelling and screaming foul obscenities is harm. Lying about someone, betraying someone, that's harm. So harm is interpersonal. Only people do harm to other people. Therapies may hurt, but harm is either wittingly or unwittingly interpersonal. So you basically assault the individual when you don't do always actions and avoid never. So patient has to go. If they come in with a problem, they have to be restored back to work and play. No disabilities, no failures. Within first do no harm. So first do no harm is a truth statement. It has science, mathematics, reasoning, cause effect, problem solution, resolution. So within first do no harm, it means the physician is responsible to return the patient back to full duty work and play. Any less is dishonorable. And there are three ways to do this. 1, 2, 3. We've talked about this before. So the 1 is all personal. And personal means mind, body, spirit, mental, emotional, social, work, family issues, car issues, grandmother issues, financial issues, plus it is muscles. So muscles are the only tissue where healing occurs. And if you never touch the patient's muscles, if you never massage, knead, unwind, stretch, pull, and needle, you have betrayed the individual. You've done wrong. You've harmed. And unfortunately, doing harm in this paradigm of our society, this matrix, it's so common for physicians to do harm that people don't even realize that they're being harmed. So never lie, cheat, steal, distort. No fictions, no fraud, no playing God, no playing a dictator or a supreme. If the physician is not eyeball to eyeball, then that's harmful. So the best example of so if you are honorable, you're not being a criminal. So harm means not helping, and you should help